Now I'd like to introduce you to one of my favorite people on the planet, Jeanne Mase, Dr. Jeanne Mase. Come on up. She's going to tell us some medical anecdotes.
Anecdotes or anecdotes? I'm not really sure. How is this working out? Medical anecdotes. I was going to call this the ramblings of a country doctor, but I thought you'd all run screaming. So the musings of a country doctor, I thought would be better. My story starts when I was 7 years old. Am I in the right place for this?
Yeah, you're perfect.
Okay. My parents told me that I was going to Boston to get a hot dog, and being the oldest of 4 children, I thought, wow, I'm finally getting treated for being the little mother. And we went and we got a hot dog at the orange roofed Howard Johnson's. And then we proceeded to go to Children's Hospital, where I was dropped off. They said goodbye, and I was left there for an undetermined amount of time, which was terribly frightening for someone 7 years old. The walls were white, the fluorescent lights were bright, no one really spoke to me. It was very frightening. It smelled a little bit like diapers, urine, old food, and at the time the staff could smoke. So there was also the haze of smoke in the place. The children were terribly frightened. They were crying most of the time. They were homesick. They were frightened. They didn't know what was next. I was the little mother of the ward. There was one child who would bang her head incessantly on the side of her crib. There were several children who were crawling down the hallway with Canadian crutches. There were many who didn't seem to have any medical problem, who were probably left there abandoned, waiting for placement. And so I would read to them in the library. I would teach them how to crochet pot holders. I don't know if you all remember pot holders. And I was really good at GIMP. Anyone remember GIMP? So it was like that sort of leathery, plastic stuff that kind of held in place, and you could make bracelets with it, and I was a GIMP hoarder. I hoarded GIMP because I never knew when the next supply of GIMP was going to come in, and I had no idea how long it was there. So one day I was asked to go for an x-ray, or actually demanded to go for an x-ray, and brought down to the bowels of the hospital for my x-ray, and they said, take everything out of your pockets. And I said, not my GIMP. You're not getting it. So I left my GIMP in my pocket. And after the x-ray, as it was developing on the wall, and I was watching it, it was back when x-rays were developed, and I was watching it being developed, everyone came running into the room, petrified, because there was this mass of what looked like worms in my belly. It was my GIMP. It was in my pocket. And then time went on, and all this time my parents were busy with my 4 siblings, so I never heard from them. And I was asked to go back to my room. And of course, 7 years old, it was like being called to the principal. It was like, what have I done now? And so I went back to my room, and I was greeted by an intern/resident who was there to take my blood. Now, you can only learn how to take blood from another human being by practicing. So these intern residents from Mass General and Children's Hospital were there to take my blood, and they could not leave until they got a sample. So I remember him stabbing here, stabbing there, stabbing again here, stabbing again there, twisting the needle, trying to make it work. It was a horror show. And at one point, I looked up at him and I was like, that nose looks like a good one to punch and get some blood, and maybe we could have this be done. So at that point in my life, at 7 years old, I decided that we could do things better. We can communicate better, can't we? We can explain to people, patients, whether they're pediatric or middle-aged or slightly demented or mentally challenged, we can communicate. We can tell them what to expect. We don't have to leave them fearful and not knowing. And I decided at 7 years old I wanted to be a doctor. So fast forward to when I was in college. I went to UMass. And I decided it would be a good idea to work at a rest home near where I lived. I could walk there, I could work a few hours, I could take care of people because I'm a caretaker. So I was the youngest person there, and there was no training at all. You didn't have to be certified to do anything. So they had me emptying bedpans, changing diapers, spoon feeding the residents, doing whatever they didn't want to do. So we finished our chores for the day, and I had an hour or two left. And I said, what do you want me to do? They said, why don't you go check on Ed in room 16? And I said, okay, I'll go check on Ed. So I walk in the room, and Ed is pretty much independent. He can feed himself, he can toilet himself, he kind of sits in the room and just kind of stares at the wall all day. So I'm like, well, what am I supposed to do with Ed? I'm a college student, I don't know what to do. So I said, there's a comb over there. Why don't I comb his hair? Everybody likes to have their hair done, right? I do. So I walked over and I started trying to find a few tendrils that could maybe make use of a comb and maybe like massage his scalp a little bit. And Ed looked up at me and he said, thank you. And as all this was going on, a staff member happened to be going by the door and looked in and went, and I was like, I'm in trouble again, once again. And I said, what? And they said, did Ed just say thank you? And I said, yeah. And they said, Ed hasn't spoken in the 10 years he's lived here. It's like, oh, okay. Fast forward to internship, and I'm in the trauma unit at Worcester City Hospital, terrified again, and the bell rings, there's a trauma coming in. So the gurney comes down the hall, and there's this disheveled, decrepit man who just smells like cigarettes, alcohol, urine, feces, and you can actually like see the flies going around his head. And his face is just destroyed. It's just caved in. His teeth are all foul. He's got bruises all over him. And he's our next person that we're going to take care of. Now, the people in the trauma ward, they're not bad people. They just become coarse. They see things every day. They see people self-mutilating. They see drug overdoses. They just see awful things all day long. And they become immune to it. They become coarsened. And so they're sort of talking about Ed while he's lying there in the stretcher. And they're, why did they bring him here? Why didn't they just leave him there? Why do we have to do this? Why didn't I just end my shift? And he's lying there. And because he can't speak, people assume that he can't hear. So we're all trying to do, CAT scans and x-rays and draw some blood and whatever, and nobody really wants to go near this person. And they finally all leave. They go off to do their other things, and they leave me there with Ed, because I'm the youngest person there, and that's what I do. So I find a washcloth, and I'm trying to sort of, clean his hair that's caked with blood, and I'm trying to stay away from the area that's really quite destroyed. His eye socket's gone, and I'm trying to, and he mumbles something, he kind of gurgles something, and I lean in, and I don't want to lean in too close, because I don't know what he's about to do, and I said, what was that? And I can't remember quite what he said at the time, but it was something to the effect of, I tried to kill myself. And when we pieced the story together, Ed had actually leaped off the railroad elevation and landed on the tracks on his base. So he had tried to commit suicide and wasn't even successful at that. And when I shared the story with my colleagues, finally the tenor in the room changed a little bit, and people started to sort of take care of him and treat him with a little bit of respect. Third vignette, when I was in my practice now, and I had a patient, a lovely patient, beautiful woman, Cape Verdean, very successful, worked in the school system, still does. Her husband's in construction, wonderful couple, so kind. They adopted 2 children, and she had a condition called endometriosis, which causes pain in your pelvis and your abdomen. And it can be severe, it can be awful, it can be constant, it can cause scarring. And there's a very easy treatment. You can take the birth control pill, and it pretty much solves the problem. But she didn't want to do that. So she'd be seeing her gynecologist over and over again, different pain medications, different ideas, what have you, and nothing really worked. And he became frustrated with her. He's like, why don't you just take this medication and make it be gone? So finally she ended up having surgery, major surgery, removal of different parts of her body, and then looking at 6 weeks of recovery, if that, out of work, what have you. And he had pretty much like been done with her. And I went into her room in the hospital to visit with her, and she invited me to sit on her bed, and I did. And I said, we talked about her children and what was going on, and I said, you know, how can we make this better? How can we not have you in this situation again? How can we, like, it's just a very simple medication to take, and we could remove all of this. And I know you're not doing this for a religious reason, and we've talked about the risks and benefits, and like, help me understand and help you not have this happen again. And she looked at me, and a lot of my patients call me by the first name, and she said, Jeanne? And I said, yes. And she said, every time I take this pill and I put it in my mouth, it reminds me of the fact that I can't have my own children. And I was like, wow, that makes sense. So my story is to listen, because often people have an underlying story. Often they have a reason for what seems like their crazy behavior. And if you just sit for a few minutes and not think about the other things that you have to do, whatever they are, sometimes you can hear those stories and make somebody's life a little better. Thank you so much.